Okay, and our final video, our final section on pain is pain assessment. And you guys should be experts at this, right? This is doing a good evaluation and talking to your patients and doing a good history. We're going to talk about that, but also then some tools. Your book has some great tools in it that can help you with this. So what do we do when we do pain assessment? We're really trying to get each person's pain perception. And those levels are going to be very different per person. So pain is really difficult to assess and quantify. So clinical pain assessment usually involves just kind of figuring out where is their level of pain, what are they experiencing. So even a question as simple as how do you feel today is a type of pain assessment. Now, it's not the best ones. There's also, asking a patient if they're same, better, or worse compared to the previous day's session. We need to get at location, duration, type of pain. All these will show up on the next screen as well. Behavior and movement patterns is also part of pain assessment. So not only what you ask them and what they tell you, but what do you observe? Are they limping? Do they not hold their arm in the same way? Do they grimace when they do certain things? Those are behavior and movement patterns. Have they changed what they do? Are they not washing their hair? Can they not walk up and down stairs? Things like that. And ideally, we'd like some standardized measures. We love patient-oriented outcomes and standardized measures. So there's a couple standardized measures that are available that help you kind of get at the various traits that influence a person's pain perception. So helps us kind of have an idea from day to day, week to week, treatment session to treatment session of what might exist. There's multidimensional pain scales and unidimensional. So multidimensional integrate pain components, including the affective and behavioral patterns. Unidimensional tends to only focus on intensity of pain. So that tends to be where when we talk about standardized measures, most of what we do is usually unidimensional, right? It's that what we call the numeric rating scale, right? From a scale of 1 to 10, 10 being the worst pain you've ever experienced, what would you call this? That's a very unidimensional. The multidimensionals are when we get into some of these Mcgill pain questionnaire, which your book has some good examples on, and same with what we call the promise, which is this patient-oriented, patient-reported outcomes measurement. So some of those things on there, the Mcgill pain questionnaire, so obviously you can just get patient self-reported pain, right? I'm actually going to jump ahead. All those type of things we want to see, right? Type of pain, quantity of pain, quality of pain, location, cause, all those questions we have embedded in your head. Something like the Mcgill pain questionnaire includes all those things in it as well. So the Mcgill pain questionnaire is again multidimensional. It has 4 parts to it. One is where you, the patient would actually locate the pain on a body diagram. So they would circle or mark where the pain is they experience. There's a second part that's verbal descriptions, which is they would mark the words that best fit their pain. So again, instead of just asking, so like, how would you describe your pain? This gives them some examples and they get to pick what words fit their pain. The third part is changes in pain. So kind of the characteristics and the durations. And then the final one is the strength of pain. So intensity. And not just intensity right now, which is important, that's the current level, but also when it's at its worst, when it's at its least. It's also usually compared to known pain. The Mcgill questionnaire is usually the gold standard, okay, of pain, standardized methods. The visual analog scale that you have, that's a vertical or horizontal line that's usually 10 centimeters. It might have a frowny face at one end and a happy face at the other. Or it, again, is numerical, and they draw a line. And then you literally measure the length of that line. And then they draw a line the next day, and you measure the length of that line, okay, and seeing if pain is getting worse and things like that. Verbal descriptor, like I said, is often either happy face, smiley face, or worst pain, no pain are usually at the ends. There is usually higher error with the visual analog scale, but it does usually have a good high test retest on individuals as long as they're over 8. That tends to be where they can comprehend the fact that this line means something. Verbal descriptor scales are usually general descriptors to identify pain. It doesn't usually try to quantify pain. So again, just trying to get at words. The patient-reported outcome measure information system, or the PROMIS, okay, is this national push across different healthcare providers to be able to kind of, again, come up with standardized language to talk about pain. So there's kind of two parts of that. There's kind of the pain scale itself and then the pain interference. So the pain scale focuses on the outward expression of pain. So sighing, crying, facial expressions. The pain interference talks about how the pain is affecting them socially, cognitively, emotionally, physically, their activities of daily life. Both of them ask them to describe them over the course of 7 days, so over the last 7 days. And then it's usually what we call a Likert scale, which is that 1 to 5 or 1 to 6 scale, which I agree, or it's, most of the time, some of the time, all the time, stuff like that. The concern with some of these is the sensitivity of the pain scales. So again, it's really only about being able to measure an individual, not being able to really be comparing across individuals, but it gives you a day-to-day idea that you can work with. So again, when you think about these questions, you can think about, can I do them in a standardized manner? How am I going to ask these questions if I'm doing it more verbally? How am I going to report that and write those things down? All that needs to be thought about. Again, this just kind of gives examples of the different dimensions of pain that we talked about. Okay, that sensory discriminative. So that's most of the questions we tend to focus on, right? The intensity, the duration. Then you have the cognitive affective. So what are their sensations as far as what they're feeling about this pain, the unpleasantness of the experience. And then it's the functional behavioral interference. What are the physical effects, the social effects, the emotional effects of this pain? And ideally, we want to target all of these. So we tend to do really well up here, and we don't tend to think as much down here. And that's where some of these pain scales can help us think down here. The Mcgill pain scale will be something that can help you get more at how is this pain affecting their life versus just what is their pain.